Good afternoon, everyone. And I was listening to like all the panel discussions and lot of talks around AI, ML, digital health, and lot of things were there. So which was quite enriching to get to know a lot of those knowledges. Now, uh, what it takes to catch up the digital health industry. Now, this discussion will be a bit different from what you were listening since morning. We are going to talk about largely around the documentation, the digitization of documents and things like that. Now, digital health industry has seen tremendous growth since last few years, couple of years. Pandemic play a very vital role to make the healthcare industry to move in a very faster way, and there is an acceleration into innovation and in technology, so that the digital healthcare industry can come up with new type of solution to cope up with this pandemic, and also how to provide a contactless experiences. Like as you can see, there are multiple apps now available who are providing the contactless experience. Now, so coming on to that, we have our esteemed panelists here who will share their insights and experience. Because one thing you cannot forget about when we are talking about digital transformation, and that is document and signatures. When the pandemic struck, many organizations, many healthcare organizations like clinical researchers organizations, they got stuck on how to capture signatures, for example, how to take a signature on a consent form, how to get a patient information, how to get a patient signature on the form. So that is something where the technology play a very vital role. And I would like to tell you that Adobe was become a very essential part when the pandemic struck, because PDF was become one of those documents which was flowing from healthcare provider to the patient, and then patient to the healthcare provider. So that is one type of those documents. Now, we have Mr. Joy Chakrabarty, CEO, PD Hinduja Hospital. We have Dr. D.S. Rana, Chairman, Board of Management, Sir Gangaram Hospital. Professor Anurag Agarwal, Dean, Bioscience and Health Research, Ashoka University. We have Mr. Jitendra Harian, CEO, Jaslok Hospital and Research Center. And Dr. Sushil Kumar Meher, Head IT, AIMS, New Delhi, India. My question, and this is a question to all of you, and maybe you can share your thoughts. In the last couple of years, as I said, we have seen the acceleration in innovation and technology. Now, when it comes to document processes, the I would say hospital management, or the you can say something like the back office sort of a thing, what are some advancements you are seeing in a digitization of a document processes? When I'm saying document digitization of a document, it's not like having a digital copy of your report or anything, but the overall digitization of a end-to-end document workflow, if I say. So maybe all of you can shed some thought. Maybe Mr. Joy, you can start because you might have to leave.
Thank you very much, and I want to thank Financial Express for inviting me and giving this opportunity. While I was listening to you in terms of what all have happened during COVID, I'm sure the healthcare, I'm going to talk from the healthcare provider space, and all of us have seen a significant adoption of this digital part of it. But I want to make one thing very clear, even before COVID, when we use the word digitization, digital part of it, we probably have used it in a very loosely. We started using the word like when you do a scanning of a document and it becomes available in your network system, it becomes digital. But according to me, it maybe technically can come under the category of digital, but it doesn't fulfill much purpose. We need to have some meaningful use of these digital records and digital information. So you started with this COVID discharge summaries. Let me tell you the kind of evolution has taken place and which is going further forward. First, in our own hospital, we started seeing that we need to have, as you told very correctly, all these discharge summaries were supposed to be uploaded, because anytime the regulatory bodies may ask that why did you discharge, what was the record, what was the criteria. So we started getting, things typed through transcriptionist, and those transcriptionists were uploading it, and through a tab, the doctors were getting it available in the COVID word, and the same thing was digitally signed by them, and that digital report was going into multiple areas, multiple contact points, which was becoming very helpful. I see and I feel we can adopt this further and take it forward in multiple areas. Also, right now, we have seen the adaptation of teleconsultation. Why I'm taking the example? Because earlier teleconsultation, doctor will write something in the medical, in the EMR and share it. But right now, there are so many formats, so many different types of, I should say, the apps as well as provisions have come where in no time a consultant can see a patient, write their comments, give the prescription, and digitally it is becoming available. So whether it is outpatient, whether it is inpatient, whether it is diagnostics, in all these areas, it has been, taken up in a very significant way, which is a good and positive sign. But once again, I want to tell that we need to look for electronic format. We need to look for something which is like a EMR kind of thing, especially in the clinical area. But we should not restrict ourselves only the copies which are scanned and archived in your system to support patient care in future.
I think very rightly said, Mr. Joy. We in Adobe also, we are a technology company. When we say the word digitization, it is not like scanning a document and having a digital JPEG copy of that document in your phone. The clear definition of digitization, what we feel, is when you can utilize that document. Maybe you can run OCR on top of it and you can search some data within that document. Or maybe you can fetch that document into some kind of a automation system, and that automation system can extract the vital information and put it in the dashboard, something like this. So, Dr. Rana, I think you are the chairman of Sir Gangaram Hospital, which need no introductions, and lot of data you also have. So, what is the your organization is doing in terms of the document processes, digitization, something like?
Let me tell you that we are amongst the first few hospitals in the country where we decided somewhere in 1999 that we should go for digitalization of the hospital records, And let me admit also that my CIO sitting here, in 21 years we have not able to achieve what we want actually. A really difficult one is that in this country or maybe in other countries also, we don't have hospital information system which can address most of the problem for all hospitals, I don't know, this is not our job, but I want that some minimum common programs, sort of software is available where every hospital can work, whether every hospital provider, whether it's a clinic or hospital, so that it is easier, to have that sort of record. I'm talking of right now EMR and this thing. ERPs are also very good then, but EMR and ERP integration is not available. And we are really struggling for that, though I still hope that we will be able to respond once we are continuously fight. I will admit with the other speaker that right now it is that we are using this technology of, though there is acceleration of use of this technology after this COVID unfortunate pandemic, but it is very primitive use, Like we are giving teleconsultation. At least I as an individual not satisfied to give that. I feel it very boring and time consuming, It is didn't satisfy patients also. It is useful for certain, like if you are just following some patient. I mean basically nephrologist. If you just say yes or no to kidney transplantation, is quite fine, But you address the problem of a patient of CKD or somebody, you find it very difficult to, because we don't have that sort of software, we can really interact with each other. In a very primitive way that patient, they have got means to pay online, but online prescription and those things are not satisfactory as far as I'm concerned, However, I feel that our Prime Minister scheme that is known, which is Ayushman Bharat, digital, transformation and ecosystem. Once that is implemented, that will be game changer. Let me tell you that over last 15, 20 years, I have been on the association as a leader on various associations of various verticals of nephrology. It is very strong desire that we should have our own registry of diseases, but we could not achieve anywhere, though we attempted, tried. But I definitely feel that once something like common data is populated by every hospital, then very soon we will be having a very big, robust data in this country. And probably what we could not achieve over last 50, 60 years, because the rest of the country, even when digitalization was not available, they were having robust data of their country. But now we will be having a strong data, though I don't know, somebody from the government side may be able to tell us that this system is working in some 6 states and some union territories, how far they have gone. But I know that yesterday I was just going through it, and at least I have not enrolled myself in ABA, so it is much easier. So hospital enrolled, but I have not, and I don't know how many of you are member of that Ayushman Bharat scheme, So, but that is going to be game changers. That is what I said. That will be real game changers in the future to come, time to come.
Right. And good to hear that Sir Gangaram Hospital has started this a way long back. Dr. Sushil, you are heading one of the biggest IT department of one of the biggest hospital in India. And IT department is one of those departments who actually own this responsibility of the term called digitization. So what's your thought on this, or what maybe AIIMS is doing around the digitization of the document workflows?
You are talking about the clinical documentations. Yeah. I have seen the journey because the last 30 years I'm working in AIIMS New Delhi. I've seen the digitization of healthcare last 30 years. I think so, means around 90s, nobody's bothered about the digitization of healthcare. At that times, we jump into the digitizations. And we have tried a lot. Many times we failed. Right now, we have a successful implementation which is running perfectly. In this journey, I have seen two things. One thing is that government is coming up new guidelines, standards. On the other hand, we have applications. In 2005, the first standardization it has been come up, EMR standard, which is assigned to the Apollo to develop that standard, EMR standard. But at that time, they are thinking that we have to make a standard which is supposed to be a single medical record for each citizen of India. But that document is not sufficient. It's supposed to talk about that, how the medical records can be interoperable. That was not defined clearly there. Then they have come up another EMR standard in 2009. That is also not sufficient. In 2012 they have come up, and 2016 finally they have published that each and every hospitals, they have to use that standard, EMR standard. Beside that, they have made another standard that is MDDS, metadata and data sets. But this is supposed to be, if you will not follow it, the metadata is not matching, then how the record will be interoperable? So any records you are keeping in the hospitals, it is in isolation manner. Second part is the clinical data standards. I have found many people, they do not follow that one, whether it is a laboratory codes or whether it is a clinical codes. SNOMED City freely available to each and every hospitals. Very few, they have adopted that ones. Then labs, Loing is available. People, very few labs, private labs or government hospital, they adopting that one. So that's why when we will talk about the interoperable, then we have failed. And when it has come to the single medical records, in that cases, what it happens, it is not possible because you have a centralized data centers where it will be all the data to be put in it. So that's why they have come ABDM, that the records which is generated, will be there, but we're supposed to give apps, my apps, which supposed to be the patient can assess his record in particular hospitals based on the own authentications, which is been Abha ID. It has been generated. It is a single medical records. It is about to be around 18 crores Abha records has already been generated. And second point is nobody is following that one is also each HIS or HIMS or clinical EMR software, it has to be tested in sandbox of NHA, which is already been defined. And for federal architecture, already been there in the process where it is, they have sent one means public opinions, that a public opinions date has already been over, they will come up with a new solution on these regards. But when we are talking about the clinical documentation in my site, we have the records for years, not in 30 years, more than years. Old records are on papers, and some clinicals are on the database. So we are scanning the records. I are putting in the medical records. Okay, and those who are coming up right now, that will be in the digital forms, other one is scanning digital forms. So what it happens when the patient will come up, that those who are already in digital forms, in that case he can access it, otherwise they have to go to the scanning records and he can see it. During the scanning, we have done some research that scan it, take the clinical codes from the natural language processing, but the handwriting of doctors are so pathetic that it is not possible to translate to the SNOMED city the clinical codes to that. So anyway, the research is going on, but my observation is that if your nomenclature of clinical codes it's not matching, there is no use of that, and the records cannot be meaningful. And if the health record is not meaningful, there is no use of that for the future analysis, or you can talk AI or ML or any predictive analysis, whatever it will do, there is no use of that. Thank you.
Absolutely correct, Dr. Sushil. I think one point which you have talked about, medical record interoperability, that is something, a very important thing, so that the versatility of that document should be there. Mr. Jitin, you are heading one of the hospital and the research center. So, what are the in terms of digital document processes you have in place?
So firstly, thank you Financial Express for the invitation. So see, what I believe is that in last 2-3 years, what India has achieved thanks to COVID in terms of digitalization, perhaps could not have been achieved in 5 to 7 years. So that is one thing. And from our perspective, I think the major shift has happened in the mindset of the service providers, the doctors, and the consumers. I think everybody is now receptive, acceptable to digital forms of the records. So what we are discussing here is digitization, which is probably a subset of digitalization. And I think that digitization together with digitalization should be able to provide a solution without having to see the paper in physical form. So I think every organization would be in a different phase, of this process. But I think everybody definitely has sense that it is required. So what we have done few things at our place. We looked at our printing and stationery cost. It was humongous, and I said we have to make it half. We are printing too many papers. How can we reduce this? So we realized that, there is a purchase order, there is a GRN, then there is an invoice, and so this much bunch of paper would come for, paying one party. I said, how can all of this, be streamlined through the system so that we don't have to print any paper. So we started with that, we achieved that. So we are already seeing that there is a 25 to 30% reduction in the printing and stationery cost. Now, this is something is that we have achieved the same objective without having to print the paper. Then comes the investigation report. A lot of patients still prefer the physical form. They would come to the hospital just to collect that report. If they have given blood samples, they will just come to the hospital to collect the report maybe the next day or the same day evening, by traveling few kilometers. But in COVID, that changed. Everybody, even, an ordinary man who's probably not that digital savvy would also understand that, it is the same thing. But yes, there are some patients, you will always have 5% people, you consider them as exceptions. But I think we as a country also, we as Indians have change, and this is going to make this digitalization or digitization process easier. Another example is that, sending these reports through email form. We also did, the screening. While COVID was around, we wanted every employee to report if anybody in his family is sick, he is sick, anybody having symptom, has he met anybody. So that also we created an online process through mobile app, where they would just send the declaration and then he's through. So that was necessary. So few, examples like this we did. So, to my mind, it's the need of the hour. It saves the efforts on the customer, it saves the efforts on the provider, and from hospital's perspective, as you all rightly said, that it's not just the scanning of the data, but ultimately having to get that data in the meaningful form so that it can be used for research or for any analytics, which can be used in the, predictive kind of situation also. I think we are not realizing, we were, some time back there was a discussion about the data, and the data has so much of strength, power, that we are not able to, leverage on that. If you are able to get the data in the meaningful form and sort of, use that information in a meaningful way, I think a lot can change. Even in the healthcare, we recently implemented this antimicrobial stewardship program, whereby the antibiotics to patients can also be predicted based on the culture profile of the patient, and the system will measure how the antibiotics were used in the hospital depending upon the patient profile. So there's a lot that can be done with the data and digitization.
Great to listen that few initiatives you have started. Just a quick announcement, Mr. Joy have some other commitment and he has to leave. So thank you, sir. Thank you for your time. Professor Anurag, you are a Dean of Bioscience and Health Research, and I know there are many prospective new future researchers are under you who are studying. So what's your thought on a digitization of a document, or maybe you are teaching something around it to your students? Or
Sure. Perhaps, one could imagine that digital health is much more than digital recording of what happens in health. So far we've been discussing how India is relatively behind because we do mostly digitization in some places. Digitization is when you start with analog processes, then you decide to scan it, digitize it. And we heard from AIIMS, handwritings can be so poor, nothing can be read. And clearly those doctors in the busy OPDs at AIIMS don't have the time to sit and type. We heard from different setups that digitalized systems where the data is natively digital from the time of origin and use are better, but ultimately it is what it is. The third level is, of course, digital transformation, which is about reimagining how you want to use digital and the process of recording and what do you want to do with it. And if Indian digital health industry got what it takes to catch up, the real topic of today's discussion, you'd argue that you can't catch by running around your tail. So if you do what everybody else does and try to do what Adobe does, for example, digitization of documents, you can't catch up to those places that already do it routinely for the last decade. You have to take advantage of the fact that you live in a nation that at the level of digital transformation of multiple things is more advanced than many of the Western nations. You have to use the fact that you should have a second mover's advantage of everything that is wrong with the way this is normally done. And what is wrongly done is we pay too much emphasis on the record on the piece of paper and extracting meaning from it. Today in radiology, it has been shown a radiologist can dictate a report in the way they believe best. And a structured report can be generated by the AI as per requirement. In the world of genomics, there is only a sequence. What do you want to report? Depending on the purpose, a report can be generated from the underlying sequence. If you start imagining a healthcare system which is not about recording of papers or digitization of that, but about incorporating newer types of data that is coming, generation of reports that are purpose-based. The purpose of a report for a radiologist, a pathologist, and a clinical doctor could be entirely different. Could we look into the fact that most reports in this country can't be read by the patients for whom they were designed? How many of our patients can read English reports? Can one take the underlying real data and generate a report of the type that the person who needs to use it can actually read? That's how the Indian digital health industry will not just catch up. It will leapfrog and pole vault over typical providers from outside who are large in their scale, but local indigenous solutions can then overtake them by treating this as a digital public good. Thank you.
Great thought, Professor Anurag. Just like to add on the documentation you're talking about. So Adobe also have something called Document Services APIs, which actually capture the data from the database and generate the personalized documents, workflows, and things like that.
No, but I would like to clarify this because really from my point of view, it's not about Adobe's capabilities. Adobe is not a health company primarily. What I'm saying is that only a small company based in India that understands the need of a person who may be differently lingual compared to English and realizes there's no need for everybody to write in Hindi. Many of these things can be automated. I mean, so since the question here is, does the industry have what it takes to catch up? I would say it will not occur by trying to simply do the things that have already been done by Adobe or by any other company. You have to try to do different things, then you will get ahead. That's what I'm saying.
Thanks. Thank you, Professor Anurag. Mr. Jiten, I like to come back to you because you were talking about some initiative which your hospital was going on. We are talking about the digitization of a document. There is one more aspect of a document is something called consent or a signature. Okay, when the pandemic got stuck, many organizations, including in healthcare sector, they went into digitize. They immediately moved their documents into digital, but they got stuck to capture the signature because the signature was earlier was an in-person sort of a thing. So what was your thought? Do you implement some kind of a solution to take a consent, especially from the clinical research or maybe a patient signature?
No, we're still taking in the physical form. We are exploring, in fact, we are in the process of considering the digital consent, and we are looking at, we are checking with the lawyers, etc. There are tremendous advantages, but there are also logistics challenges that, not every patient can respond to it. So how do we, make it a complete process? Because unless you have everybody, doing it, you can't have some forms physically signed and some forms digitally signed. So, we are looking into all these logistics challenges, but it's the need of the hour. Again, another challenge we have with the digital signature is the form in which the person typically signs and digitally signs. They're two different. So if you have to prove it legally, whether the same person sign, I don't know. I mean, how do you do that unless there is some that you take a code or something of his device. Which is also kind of, saved. I don't know, because that is something, because I have also signed few documents digitally, the contracts, etc., but I couldn't recognize my own signature. So that is one challenge that is there as such.
Right. So basically, just briefly, I'll tell you, like in a digital signing, we have a digital certificates which get bind with the document, and that's play the proof of a like a legit signature. Dr. Sushil, what's your thought on this digital signing process? Because when we're talking about digitization of documents, sign is also part of it. And in a medical record, there are almost all the documents require some kind of a, approval or a signature or something like that.
That kind of process we do not have. Basically, what it happens, any records, it is been authenticated. Let's take one lab reports or a clinical notes. The patient has to download it from his mobile. So each registered patient, their mobile is already registered. So we generate a OTP, and after that, the reports has to be generated in a PDF form. Some are the PDF, some are the in the other forms. But in the back office, we have a digital signatures. Okay, the documents which will go to the ministry, and that is online basis. So we have a digital signature dongles, which is put it in the machines, and you have to install it. When the document has to be digital signatures, you have to process in that, and then it will transfer to the other persons electronically. But at the end, there's a print. It will come up. It digitally signed. So this is the things. It is in the back office cases, not in the patient care cases. But in patient care, you have to look into that. What is the digital signature? First, you have to understand that way. The digital signature itself will come up very secure manner, and document is owned by the person which is been given. So that's why we are using the dongles as per government issued to us. But for the patients, patient record is very precious. At any time, any moment, doctors may need it. And the things supposed to be accessible to either patient or doctors or treating doctors, or the future doctor may be treating some other doctor treating the same patients. If the past medical record is not available and you need a digital signatures, in that cases, totally it is no use of that. So that's why a digital signature in the patient records, it may not be useful till date, what I feel it, because the technology is not developed at that extent. But two things are you have to look into it. Digital signature means use authorized document with you, okay, and you have signed it. But when you will talk about the any patient records in that cases, the record is owned by the patient itself. The meaning, my patient records, I am owner as per rule, as per guideline, and without my permissions, neither my wife or my kids or my parents, they can see it. So if you put these sort of things, how it will work? There is another process is required to do it. That's why the personal digital records, the digital personal records standardizations, it has not come up. It is in the parliament, and yet it has not been approved. The first drafting, it has already made 4 years back. The committee has formed, that not been approved. Now it has come up. Another documents that is in the process. When it will come, then we'll get the direction that what way the data or records or information can be shared with the different users. So that's why healthcare is lacking that way. And that's why the interoperability is also coming near questions, that how it will interoperable. It will make the standard also, but how we can share it? Is there any guideline? Till date, no.
Got it. I think when we talk about interoperability or maybe collaboration on a document by multiple, maybe a doctors or maybe healthcare administrative people who want to collaborate on one single document, that is where I think the compliance, privacy, security, all these things play a very vital role. When we talk about digitization, there is one thing more comes into talk, and that is something called cloud data, right? So, Dr. Rana, I have a question from you. So, you also have, you talk about a lot of data is there, and you started way long back. What's your thought on taking the data onto the cloud, because there are many collaboration which will only happen. Let's say I'm a doctor, I'm sitting at home today, and you have to share a document with me for my review. And so then you need to share it through the internet. So what's your thought on taking the data on a cloud and doing a collaboration or in a hybrid mode?
Yeah, I agree with them. Just let me first clarify my position with our hospital. We are running like ERP very successfully within the hospital. As far as EMR is concerned, we are running successfully appointment system, making payment, making bills, and making discharge statement, etc. Those things are going on. My satisfaction will be as a clinician when we are having a robust EMR actually, that we have got electronic medical record, To my best knowledge, there are even, I don't know many hospitals which they are doing electronic medical record of their patient, followed by indoor, but they are not even outdoor actually. So till we have got that data which we want to share and which can help the government or our policy maker to plan strategies for providing best care or best service to the patient. That is what my botheration is there. And that is where I feel that probably Ayushman Bharat mission has got a lot of promise to play in the near future, But all of us, those who are running labs or running hospitals, they are running their hospital. As for running the hospitals and institutions are concerned, that is there. But I feel that it will be successful when our aim is ultimately to provide patient to the treatment. It's not providing, taking appointment, bringing more patients, but ultimately how can we provide better care? When we have a large patient data, that is not available. Forget about the whole country, within the hospital that is not available. So that is problem, That is what I want to know from other hospitals, as any hospital got. I know Apollo had devised their own formula, own software. And I went to their major hospital just for inspection in Chennai. Then I just asked the doctor, are you following your system? He said, we hate it, just keep it. They don't want to even keep it nearby. Reason being that he was of my age, so simply our age people do not want to document everything on the computer. But that is why something in the near future, I see future generation, they know how to populate data even on their telephone and all this thing. And somewhere there is still telemedicine. We have been talking, I have been listening regarding telemedicine. Telemedicine is very poor in our country because of various factors, which you people can address, those who are tech people, It is there right now. It became popular because of compulsion, because of this COVID. But whatever telemedicine we are giving right now, that is far from satisfaction,
Got it. Great. We are running short in time, and I have a last question and maybe quick view from all of you. Maybe we'll start with Professor Anurag. According to you, what is the future of this digitization of a document, especially in the healthcare sector? Because we are now moving, in fact, we have moved into a digital healthcare now. What's the future you looks like?
If I imagine the future, I see reducing importance of the document per se, greater importance of the underlying data that forms the document, initially generated and stored in a pure format, with further documents being a verifiable trace of whatever it is that you want to report.
Good. Jitin, your last thoughts.
Yeah. So I think this process will continue. Obviously, we will get into more and more digitalization. I don't know whether we can become 100% paperless soon, but I think journey is towards that. And these governments, central government's initiatives, if they are implemented well, and if we are able to get this PHR kind of thing or ABHA kind of things, and we are able to sort of gather the entire data related to a patient at one place across the places wherever he has gone, I think that will improve the quality of care tremendously. So I hope we reach to that point soon.
Great. Dr. Sushil.
Yeah. The future of healthcare, people are looking towards the personalized healthcare, precision healthcare, you can say. That runs in the 4P. Your personalized, predictive, and so these 4 P's are there. Okay. In that cases, what happens? You need a digital records. It is not in any PDF form or any analog forms. The government of India, the standards which is given, that has to be implemented. Otherwise, we can't get a data which is supposed to be meaningful and which can be processed further. If the data is captured in the digital form, if you are not using for any purpose, whether it is a administrative purpose, whether it is a research purpose, in that there is no use of that. So one has to be follow the because the standard which is formed by the government, they have already studied the international standards also, and that some things there has been already been adopted. Just clinical notes I have told you, SNOMED City, how many people are using it? That's supposed to be used. It is a very good tool, people supposed to use it, and they are also giving free of cost training to the organizations, whether it's government or private. CDAC is giving it. Okay, so that has to be done. And for the labs, I already have told you that lowering is the standards. That has to be adopted, so that the labs, whatever you are doing, any labs, any part of this, you can't do interoperable, and it will be same meaning. It will come to you.
Right. Dr. Anna, your last talk, quick.
I just wanted to ask somebody in the audience, somebody in the panelists can tell me that how much progress we have really made as far as Ayushman Bharat Health Mission is concerned, yeah. How much progress we have, how far we have gone as far as.
See, we are already adopted the Ayushman Bharat Digital Mission, what is guideline is there. But we are not 100%, but we are in the process. As AIMS, it is a very huge institute, and all the healthcare providers, they're supposed to have an IDE, so that process is going on. And in AIMS, what it happens, the people, those who are coming to the hospitals, it is very fast, it is changing. Some people, they are coming for 1 year, some people, they are coming 6 months, some people, they are there for 2 years and 3 years. So the process, it is we are in the process to adopt all these things. For the application side, we are totally ABDM compliant because it is developed by NIC.
Got it. I think we are over time. Unfortunately, we will not be able to take any questions. So maybe in offline, if you have any question, you can connect. And thank you all our panelists. Thank you for your thoughts on the digitization of a documents workflow. Because as I said, in a business, documents play a very vital role. So until unless you do not have an end-to-end document workflow digitized, maybe then the complete digital transformation, you can't say it's get completed. Thank you, everyone. Thank you.